All right. Well, good afternoon, everybody. My name is Joseph Stango. I use he, him pronouns, and I'm a senior program manager at AIDS United, working on this exciting relaunch of the Sector Transformation Initiative. Today, we are gathered to talk about the initiative itself, as well as specifically focus in on the request for support process that was launched last week and that will be ongoing throughout the following grant year. We have quite an agenda that we want to cover, and it really starts by addressing the moment that we're in and the reason that AIDS United, in collaboration with the collective good, are relaunching the Sector Transformation Initiative. So we'll talk about what exactly is sector transformation, what is our approach to sector transformation, and what is the composition of the different components for sector transformation. Once we go through that, we'll narrow our focus specifically on our National Rapid Response Technical Assistance Program, through which organizations across the country are able to submit requests for support on topics related to organizational change. We'll talk about the different levels of technical assistance that organizations can access through the National Rapid Response Program. We'll even go through a few example opportunities that folks might submit. And then we'll also walk through the submission portal itself. Finally, we'll look at a timeline for engagement, as well as the kind of engagement you could expect if our team is able to take on your request for support. Then we'll go ahead and close and open up the floor for questions and answers. All right. Ooh. Throughout this process of deciding what exactly sector transformation might look like in 2025, our team went through so many iterations and thinking about what could this be? What does it need to be, given where we are as a country, given where the healthcare industry is in our country. And it is very hard not to move forward in general, but specifically within this initiative, without acknowledging the detrimental changes that the current administration have been making broadly across the federal government, but specifically to HHS and all of the different programs that have historically helped ensure that our clients receive the care that they deserve as human beings in the fullness of their dignity. We're facing a moment where there is extreme contraction of funding, and as a result, many organizations are unsure whether and how they'll be able to keep their doors open for the clients. Additionally, we're facing extreme political attacks against the most vulnerable of our communities, especially our trans and gender nonconforming peers. It's easy to freeze in this moment. It's easy to push aside thoughts of what if, so that we could focus on business as usual. Yet, because our leaders are not operating on a business as usual framework, we no longer can either. And the fact is, as the HIV community, we're primed for that fact. Since the early days of the epidemic, this community has supported each other, has executed mutual aid, direct action, and civil disobedience to ensure that our voices are heard and that people in power make the necessary steps to assure us of our future. And so I do want to start here with a quotation from a book that's recently given me some glimmers of hope. Sarah Schulman, the author of Fantasy and Necessity of Solidarity, writes, regardless of specificity, solidarity always requires awareness, self-criticism, consciousness, the decision to act, and the need to create strategy, to build alliances, and to listen. It always requires taking chances, making mistakes, and trying again. This quote for me is really the launching point for sector transformation. Sector transformation isn't an ordinary grant-making program that many of you may be familiar with coming out of AIDS United. Indeed, sector transformation is going to try to do things differently. We want to work with organizations to help identify goals that you all set for yourselves and help you get there. We do not want to enter any space and tell folks what to do, how to do it, but we want to offer ourselves as servant leaders to help you all accomplish the change that you find is necessary to ensure that your clients in your community continue receiving the healthcare that they deserve and that they need. And it is going to take vulnerability. It's going to take taking chances. And it's going to take making some mistakes, but importantly, learning from those mistakes and finding new ways to build those alliances, finding new ways to cooperate and to collaborate and to push forward as an HIV movement. And so what is sector transformation? Well, this reimagined sector transformation is really designed to enhance your organization's efforts to adapt, respond, and thrive in this current moment while you face a national contraction of funding and increased political hostility. The team that will be guiding you all along this process is a strong collaboration between AIDS United and the collective good, with generous support from Gilead. The three bodies here will jointly serve as the initiative's backbone infrastructure to provide technical assistance and guidance as you all plan for the next stage, not only your organization's life cycle, but of the life cycle of the entire HIV service ecosystem in your city or region or state. And we're guided by this North Star here. And it's a North Star that in many ways has been achieved, in many quiet ways, many impressive ways, and yet, nonetheless, still remains off in the distance. You know, it truly is that North Star that we're all working towards. A world where HIV service leaders and champions embody autonomous models of cooperative action for the healthcare field at large through the practices of justice, resource and knowledge sharing, and human dignity. We plan to achieve this through responsive technical assistance, coordination support, and resource sharing. We're going to act as an organizational doula to ensure that HIV leaders can accomplish self-selected transformational change goals at any point throughout the organizational or systemic life cycle. What is that going to look like, you might ask? Well, by anchoring the work of sector transformation in principles of collective impact and transformational change, AIDS United and the collective good will support the development of coordinated, self-sustaining regional responses while also providing timely national assistance to organizations facing critical structural transitions. We hope to both address the structural and operational challenges that threaten the long-term viability of HIV service ecosystems. And this multi-pronged approach recognizes that systemic transformation is most successful when it's supported by a mix of local coordination and national infrastructure. Through the provision of that backbone support, through the provision of participatory planning processes and real-time technical assistance, the sector transformation team will work to ensure that organizations are not only surviving, but adapting with purpose and intention in a changing funding and service environment. And so we've established 4 key components that you see in this little pyramid here on the slide. The bedrock component is that National Rapid Response Technical Assistance Program, getting the support out that organizations need to ensure that operations can continue, or in the tragic case where an organization can no longer continue, that clients can receive care at another organization locally. Building off of that bedrock, we are engaging cities and regions within a collective impact cultivator to help establish common goals that networks of organizations can work towards to ensure that a rising tide truly lifts all boats in the region. From there, we plan to establish a leadership collaborative in which leaders and champions from across the country can meet and discuss the unique challenges of leading HIV service organizations and advocacy organizations, a place where leaders can get ideas off of one another, work through a challenging issue, and begin to strategize and think of those new possibilities that will keep the HIV sector at the bleeding edge of healthcare transformation. And at the very top of our pyramid is our resource library. All of the learnings and all of the tools that are developed through these 3 programs will be crystallized in tools that can be accessed by people throughout the sector in a library that is free to access and that will be responsive to the needs of the community. As the initiative grows and moves forward into the future, we plan to not only add new tools to the library, but adjust tools to ensure that they stay relevant, considering the changing policy landscape, the changing funding landscape, and the changing organizational landscape. But now let's focus in on the National Rapid Response Program. The purpose of this program itself, as the bedrock component of sector transformation, is to provide that national level technical assistance. Our goal is to equip organizations with the tools and support needed to make responsible strategic decisions regarding their future, whether that involves adapting current models of care provision, pursuing growth, winding down operations responsibly, I might add, or even merging with another organization. We plan to work with organizations on a deep level to approach any given major transformational change strategically with purpose, and to ensure that not only is leadership bought in, but that staff at those given organizations are bought into the changes that will be made. To complement this deeper technical assistance, we're also going to be offering lighter touch support system for any organization that requires some support. Through a simple submission process, organizations will be able to submit TA requests, which can be addressed via Zoom consultations, email guidance, curated resources, or even referrals to peer organizations within the broader AIDS United and Collective Good network. In addition to serving folks' individual needs, this system will actually help AIDS United and Collective Good track emerging trends and challenges across the sector, allowing for more tailored support and targeted resource development. Within the National Rapid Response Program, we intended to provide 3 levels of technical assistance. The first of which, resource share and TA webinars. Really, those tools are what you'll find in that top of the pyramid, that library component. Again, these are free to access and will be launching August 1st. Folks who would like to access these resources will have to sign up on the website to download toolkits, webinars, manuals, even access to AIDS United's Thinkific courses. And folks who access these resources will not have to submit a request for support. However, for levels 2 and 3 of technical assistance, folks will have to submit a request for some more support through the system that I'll walk through in a few minutes. For the second level of TA, which we're defining as low level of TA support, our team will dedicate about 3 to 5 hours of phone or email communications on targeted leadership operations or proposal writing challenges. As relevant and as appropriate, we'll also connect folks who receive TA at this level to our community support network, a broad range of folks within the AU network who can provide support based on their own experience of dealing with similar issues. At that third level of technical assistance, which we're categorizing by ongoing and systemic technical assistance, the sector transformation team will really work with individual organizations on a given transformational change, whether that's merging with another organization, growing or expanding or adapting a scope of services, or making the difficult decision to close the organization. At every step of the process, from defining the baseline of where the organization is to accomplishing that transformational change, we will work within the organization to define out what technical assistance is needed, who needs to be involved in these changes, how to develop buy-in, especially with the entirety of C-suite and board of directors. And for the time, staff time to contribute and really engage this type of technical assistance, we will be providing organizations who receive third level technical assistance a micro grant of $15,000. Now, I do want to note and really emphasize here that to receive level 3 technical assistance requires C-suite and board of directors involvement. And this is because we are really focusing within this level on organizations that have already selected a type of transformational change and need support planning and executing it. Within that third level of transformational change, our organizations will also pilot an organizational assessment. This will help organizations understand their baseline. How are they operating in terms of leadership, in terms of finances, in terms of staff and community culture, in terms of client needs and client satisfaction, and several other domains to give a comprehensive picture of where the organization stands once we begin engaging within our technical assistance plan. Our evaluation team has been developing this organizational assessment by analyzing and incorporating components of various tools that assess certain aspects of organizational health, including the Organizational Capacity Assessment Tool, the Organizational Readiness for Change Assessment, the Program Sustainability Assessment Tool, and AIDS United's own Racial Justice Index tool. The organizational assessment itself has two components. One is a self-directed questionnaire executed by executive leaders and board members to identify organizational strengths, gaps, and readiness for change. And then a key informant interview guide, which is a semi-structured interview guide for a representative selection of staff that's focused on understanding internal dynamics and capturing an environmental context that may not be clear from the comprehensive readiness assessment alone. With the support of the sector transformation team, leadership will select that representative group of staff who would help participate within these key informant interviews. I will note, because not all organizations will be receiving level 3 technical assistance, not all organizations will pilot the organizational assessment. However, it is our intention to release this publicly after our period of testing and refining the tool with our pilot cohort. We intend to launch this nationally in early spring of 2026 so that all organizations can pick this up at any point and execute it without the support of a backbone structure like sector transformation. Now, you may be wondering, what types of requests might I be able to submit? I have an idea, but it's not totally fleshed out, or I'm not sure it's totally appropriate. I want to give you a few examples of requests that could be addressed within the National Rapid Response Program. The first is around growth or adaptation. Let's say our organization recognizes a growing need for mobile services and need help planning for and monetizing such an expansion. Now, in this case, this could be a level 2 or a level 3 request. Within a level 2 framework, you could meet with a technical assistance liaison over the course of 3 to 5 hours to talk through monetization, including insurance reimbursements, including coordinating with 340B money or other avenues that could help maintain the van, the supplies, the staff. And we could connect you to another organization who's done something similar. If this organization is at a point where, hey, we bought the van, we have begun planning, but we really want support to ensure that we're doing it as well as possible, this could be opportunity for level 3 technical assistance. Second example of a merge. Our organization is uncertain we will be able to maintain services with our current levels of funding and support. And we want to understand better what is the process of merging organizations, including how could we actually make a pitch to an allied organization to merge. This is a great example of something that could be a level 2 technical assistance request. In this scenario, within that 3 to 5 hour window, a TA liaison could work with your team to walk through the process of merging organizations. What types of paperwork need to be in place? What types of coordination between organizations need to be in place in order to ensure a successful merge? And even discuss what is a realistic timeline to successfully merge operations and bring on board all staff from both initial organizations into the newly merged organization with its own organizational culture. In this final example of responsible closure, our organization estimates that given current funding and reserves, we have to make the difficult decision to close our doors, and we need to support to do so responsibly so that clients' care is not interrupted. In this case, this is a strong case for a level 3 TA support. In this instance, we will work closely with organizational leadership to ensure that we understand the immediate picture of the organization, how long the organization is able to stay open, and then within that timeline, establish action plans so that we can transition clients to other allied organizations, coordinate with staff on hiring opportunities elsewhere, and to ensure that they also are fully understanding of the reason for closure and what it will take to actually close the organization. All right. And again, these are just 3 examples of types of requests that you can make. We encourage you to submit requests, and once those requests are received, they will be reviewed by our team through a process that I'll describe in just a couple slides. But first, I do want to go over the submission portal itself. So I'm going to go click on the submission portal. And now you should see my web browser screen. This is the submission portal itself. You'll be able to access it not only in the slides that will be shared after the webinar, but if I may actually navigate to AIDS United's website.org. On our homepage here, you can click on this National Rapid Response Technical Assistance Program button, scroll down, and in this line of text, you can click Request for Support Form, and it will bring you right to that same screen. If for whatever reason you do not complete this in one sitting, you are able to save your progress and resume it later. I will say of the few requests we've received so far, it has taken folks between 45 minutes to an hour on average to complete the form itself. Much of the form itself is requesting organizational information. So some basic things like organization name, EIN, types of organization, staff size, location, primary contact information. And then we do talk about ask about organizational leadership. This is part of our AIDS United's Racial Justice Index work to support the ongoing praxis of racial justice and justice at large, and ensuring that organizational leadership mirrors as much as possible the communities that we serve. That said, your responses to this section will not hinder or determine whether or not we engage with your organization on technical assistance. Again, we ask around organizational budget, conflicts of interests, and brief organizational overview that helps us understand the communities that you do serve, your organizational reach. And then finally, we jump into our sector transformation specific questions. The questions themselves are relatively direct. Again, this is not a normal grant submission. And so we are not expecting you to have a fully thought out project with key performance indicators, with expected numbers of clients served. Our focus here is really listening to you on how the rapid changes in society, in the political realm, and in funding mechanisms have already impacted your organization, or how you expect them to impact your organization. And then importantly, how has your organization considered transformational change? Or even whether you have considered transformational change thus far. We also give you space to talk about how the types of technical assistance you believe that you need in order to accomplish the change that you've described, including methods or topics of TA provision. And additionally, if you were to receive that level 3 technical assistance, how might that micro grant be utilized? And finally, and especially for folks looking to receive level 3 technical assistance, you must indicate whether executive leadership and board members can commit to working with the sector transformation team throughout the TA process. Once you complete the full form, you can review and submit, at which point you'll receive a thank you screen notifying you that the submission was received, and allowing you to download copies of your responses. At the bottom of the screen, again, you're able to save your progress and come back to it later if you need some additional time. And that is the submission process and portal. Now, for folks who have received technical assistance through the submission portal, you are welcome to submit for another support request. Just note that we are going to prioritize organizations who have yet to receive technical assistance, so that within the queue of response requests, we will ensure that all organizations who've yet to receive support from us are prioritized. And towards that end, I want to make a note, and again, unlike a traditional grant opportunity, we're actually going to be reviewing these support requests on a rolling basis. So all requests, regardless of the intended level of technical assistance, are reviewed on a rolling basis, and as a result, response time will vary based on the number of submissions in queue, as well as the resources and staff availability. If for whatever reason we are unable to accept new requests for a given period of time, we will temporarily close the submission portal and inform the sector through AIDS United's communications platforms, including putting a blast on the grant submission page so that you are aware before attempting to submit a new request for support. If for whatever reason you have not received a response from our team within 3 weeks of submission, I do encourage you to contact me at my email address listed here, and I will ensure that we review your technical assistance request and inform you of where within the queue your request has fallen. In terms of expected engagement, we do want to ensure that we lay out expectations that are clear, so that you know what to expect when you do submit a TA request. Once you do submit a TA request, our team will review it, determine the level of support that such a request will require, whether it is a level 2 or a level 3 request. If it is determined that it's a level 2 technical assistance request, the request itself will be placed in a queue. And through an adapted agile project management format, a dedicated team of TA liaisons will triage the requests and assign them to the appropriate liaison based on fit and availability. Depending on the scope and appropriateness, the assigned liaison may also bring in an allied subject matter expert to support TA provision. In terms of process, we would begin this level of technical assistance with an introductory call, during which we may provide some initial technical assistance, but we will certainly establish the scope of expected technical assistance, establish a timeline, and link you to any available resources that could immediately help you begin planning. Over the course of that 3 to 5 hour bandwidth, we will execute the TA plan. And once the TA has been provided, we will send out a closeout survey, allowing you to give feedback on the support that you were given, on hopes for future technical assistance, and an opportunity to provide us any other information that you are seeing on the ground that you believe needs to be addressed within our technical assistance model. Within the level 3 technical assistance, and I apologize, I'm seeing a quick typo. This should read level 3 technical assistance. These organizations would actually contract with AIDS United with a defined scope of work. And that is because of the $15,000 micro grant. Once the contract is executed and the micro grant is remitted, a dedicated technical assistance liaison will be assigned to that organization, and that organization will gain access to a TA ticketing system, allowing them to submit technical assistance requests to that TA liaison in real time. Similar to level 2 technical assistance, we will start with onboarding, during which we will discuss the intended transformational change that your organization is planning for. Again, we'll define the scope of our work together, we'll establish a timeline, and we'll link to available resources. The second key step within this level of technical assistance is the piloting of that baseline organizational assessment. This piloting will take place over several sessions in conjunction with sector transformation staff, so that the organization piloting the assessment understands clearly how to go through it and has support to understand and interpret the results of that assessment. Based on the results of the organizational assessment, and together with your technical assistance liaison, we will develop, execute, and monitor a TA plan to get you from baseline to executed change over the course of the remaining grant period. This could include monthly monitoring and coaching calls, as well as a development of a change action plan. Within this level of technical assistance, we could also develop personalized TA tools that address specific challenges that the organization is facing in order to accomplish that transformational change. And as relevant, those unique tools will be universalized and added to the resource library that I described before. In closing, I do want to, first of all, acknowledge that that was a lot of information, and I do look forward to your questions in the final 15 minutes or so. Um, but I do want to note, as our implementation of sector transformation is occurring amidst rapid dismantling of funding and research structures, it's very possible that a significant environmental, political, or societal event will impact the sector. And as a trickle-down effect, change the nature of our project. To mitigate these risks, our team is conducting an ongoing landscape analysis through tailored surveys, as well as close contact with stakeholders via check-in calls and learning exchange meetings across the country, so that we can rapidly identify any potential risks and develop a responsive plan to mitigate impact or adapt implementation as needed. But if I may be vulnerable, just as you all are in a period of uncertainty, we too are stepping forward with courage, yet with the knowledge that there is a lot of unknown down the road. Now, we plan to approach this work earnestly, in solidarity, and with a keen ear to listen to what you all need, what the community needs, so that as much as possible, we can get through the next few years together. We can remain resilient and come out the other end stronger, more autonomous, and more just than we started. Thank you very much for attending this webinar. Again, if you have any questions that we can't address during this call, you're welcome to email me and Lewis at our email addresses here, or at the General Sector Transformation email address listed here. In this slide too, once you receive it, there is a link directly to the request for support. And with that, I am glad to take some questions. Thank you all so much.
There was one question in the chat earlier. It was just asking if grant funds could be used for technical infrastructure like fundraising software.
Aiden, I apologize. You broke up. Was the question around implementing fundraising?
I'm going to resend it in the chat. Can grant funds be used for technical infrastructure like fundraising software?
Unfortunately, the grant funds cannot be used to develop infrastructure, whether electronic infrastructure or physical infrastructure. These funds would be dedicated to staff time to support the change process, to provide incentives for staff input or community input on the process itself, or other components like that. And Vanessa, yes, I can put up that slide again.
Thank you, Joseph. Appreciate it.
And again, this level one, no need to submit a request for support. On August 1st, we will make the initial batch of tools live on the AIDS United website. And again, this library of resources is going to be nimble and will expand as time goes on. We plan to add additional resources approximately bi-monthly. And again, as we learn throughout the process from engaging the other levels of TA support or the other components of sector transformation, like the collective impact cultivator or the leadership collaborative, we will add documents related to those learnings to this library. Megan, thanks for your question in the chat. The question is, do level 3 applicants need to be service provider organizations, or can they be organizations that work with HIV service providers? The answer is yes. Organizations do not need to be direct service providers themselves, but could be advocacy organizations that advocate on behalf of folks living with HIV. They could be a social service provider who coordinates with HIV care and prevention providers, such as housing, harm reduction organizations, and organizations like that.
Thank you.
Yeah. And I did see Victoria, your question in the chat. We can make the transcript available as well. All right. We have about 9 minutes more for questions. So happy to give folks another minute to percolate. Add that in the chat. But again, if as you sit with this information and a question pops up, feel free to contact us at the information provided, which I'll put up back up on the screen now. Great. I see another request for the transcript. What we will do is we have the list of registrants for this TA webinar. So once all of those materials are uploaded to the AIDS United website, we will email you all with direct links to the webinar, to the slides, and to the transcript.
We had a question from Paul Fisher. I don't know if you see this one, asking if the level determination is something that orgs apply for or if it's decided by TA staff.
Yeah, that's a fabulous question, Paul. Thank you for raising it. The level of TA is going to be determined by sector transformation staff in collaboration with our advisory board. And it will be dependent not only upon the level of technical assistance as described within the request, but also the availability of staffing and resources. Our goal is to provide some level of technical assistance for all requests that are received, but we are limited just based on team bandwidth as well as the amount of resources we are able to disseminate. Yeah, Shannon, thanks for that question. So the question is there any space for or wiggle room, we could say, for C-suite level and board of director involvement, especially for clinics housed in larger organizations like a UCSD or a general hospital system? Within this scenario, we would work with senior leadership within your clinic based. So that could be a principal investigator of the clinic to determine that change level. However, if the change would require some type of sign off from someone in the larger system, whether that is someone at the C-suite board of director level, we would, it, a pathway to ensuring that buy-in would need to be made clear before we engage with you on a level 3 technical assistance request. All right. Any more questions coming up for folks? These have been really great questions so far. Thank you all. All right. Well, I think since there's been a gap in time between our oh, here we go. What is the deadline? Oh, that's a great question. So it is a rolling basis. The portal will be open essentially as long as we can continue the initiative. So even if, let's say, come December, a new TA or support comes to mind that you need, you're able to submit at that point, and then your request would be put in queue and addressed based on where um, it is within that queue. So this next question, my org is a 501, but looking for funding. Am I in the right place? You know, the answer is a bit of a yes and. I will say this is not meant to be a traditional funding mechanism, right? So we will not be providing what folks may come to expect as a grant from AIDS United. While level 3 or sites who engage with us at the level 3 of technical assistance will receive a micro grant. That grant is really meant to support staff time to help ensure that folks can dedicate time and effort to accomplishing the transformational change. So if you are looking for broader funding to support your organization, I would suggest that you continue doing some research and stay in touch with AIDS United in case more traditional grant opportunities open up. Yeah. All right. Last call for questions. All right, then. With that, I think we can move to end the webinar. Again, this webinar, as well as the slides and the transcript, will be made available to folks on the AIDS United website. And once those have been uploaded by our communications team, we'll send out an email to all folks who did register so that you can quickly access the materials that you need. Thank you again for joining, and I look forward to hearing from you all soon.